Hello everyone, I am Dr. Prasad Pande. I am a gastrointestinal and hepatobiliary surgeon at Fortis Hiranandani Hospital, Vashi. Good evening everyone, and today we will be talking about gallbladder surgery. Uh, it is one of the commonest surgeries performed worldwide, and there are simple gallbladder surgeries, there are difficult gallbladder surgeries, uh, there's a whole spectrum between which the entire gallbladder pathology lies. And today we will be talking about them one by one, step by step. And to begin, let me tell you that gallbladder stones is one of the most common emerging problems across the world. And apart from cancer, it is probably if not the highest, it is one of the highest diagnosed pathologies of the hepatobiliary system in the world. So, what causes gallbladder stones? To begin with, gallbladder is a storage organ. Liver produces bile that comes to the intestine via the bile duct. Now, the liver produces around 1.5 liters of bile every day, and we don't require so much of bile on a daily basis. So, what the body does is it stores this bile in a sac like thing that is attached to the bile duct. That sac is called the gallbladder. Now, bile comes from the liver, it gets stored in the gallbladder, and whenever we eat something, especially when we eat something that is fatty, that is oily, or when we have a heavy meal, that time the gallbladder contracts. Just like the heart pumps the blood, the gallbladder pumps the bile down into the bile duct, from there into the intestine. And that bile has chemicals that helps us in digestion. So when there is a problem with the gallbladder, when the bile does not come down as well or in the quantity required, then the cardinal symptoms of gallbladder pathology start presenting. These symptoms are pain in the upper abdomen or in the right side of abdomen, feeling of heaviness or bloating, especially after food, acidity, frequent acid reflux, and occasionally it can also cause either vomiting or simple retching. So the problem here is that the gallbladder is not emptying and getting its bile down as it should. So what causes these problems? Now there is a triad of pathologies that results in formation of gallbladder stones. One is nucleation, the second is saturation, and the third is stasis. So, nucleation means that small cholesterol crystals form the nucleus of bile pigment around it, and these result in what we call formation of sludge or fine sand that is a precursor of gallbladder stones. The second is saturation and crystallization, where such small sludge particles and sludge balls coalesce and they form little balls of cholesterol and bile pigment. And the last is probably the most important cause of gallbladder stones, which is stasis, which means that, like, if water is stagnant at any place, it develops moss. In the same way, if the bile remains static inside the gallbladder, if the bile does not keep moving as it normally should, that bile will develop these small crystals. So this triad of nucleation, saturation, and stasis leads to formation of what we call gallstones. Now, there are multiple causes of why a person may have gallstones. Uh, there are some dietary factors, there are some environmental factors, and there are some unknown factors that we have not been able to find out yet. A very common perception is that those who have high cholesterol will develop gallstones. While that is not entirely untrue, cholesterol or high blood cholesterol only forms one part of development of gallstones. Gallstones are found in people with normal cholesterol. Gallstones are found in people with low cholesterol. We have had healthy, fit sportsmen and athletes presenting with gallstones. So clearly, blood cholesterol levels are not the only cause of developing gallstones. There are other factors as well. There are certain changes in the gallbladder wall that make the gallbladder contraction weaker, which leads to what we call stasis. Now, like the heart pumps blood and we measure its ejection fraction, you must have heard a lot of doctors talking about ejection fraction of the heart. So, similarly, the gallbladder also has an ejection fraction. And a Turkish study showed that in cases of gallstones, the ejection fraction, which normally should be around 90 to 95%, drops to less than 35% in patients who have gallstones. In simple terms, what it means is that if there is 100 ml of bile inside the gallbladder, ideally when the gallbladder contracts, it should expel out around 90 to 95 ml of that 100 ml of bile. But when there are changes in the gallbladder, when there is weakening of the muscle, that time the gallbladder contractions become weaker and only about 20 to 25 ml out of that 100 ml of bile is expulsed out. So that leaves a huge amount of bile static inside the gallbladder that can lead to formation of gallstones. Another problem is iron deficiency anemia. Iron is responsible for certain muscular activity of the gallbladder, and in absence of adequate amounts of iron in the body, again the gallbladder stasis can cause formation of gallstones. So really there are multiple factors that can lead to formation of gallstones. There are biliary infections, there is diabetes, there is what we call fatty liver. So all of these are risk factors that can lead to formation of gallstones. But the universal outcome of all of these risk factors is that the gallbladder cannot function normally. It develops stones, and that is where the trouble starts. The patient presents with vague symptoms such as what I explained earlier, that the patient feels bloated after eating anything. The patient says that I have frequent acidity or acid reflux. The patient may complain of pain on the right side of the abdomen. That pain indicates that the gallbladder is trying to forcefully contract and expel the bile out. So that pain may remain for a few hours, maybe 2 hours or 3 hours, and then spontaneously go away. Sometimes one of these stones may get stuck at the neck of the gallbladder. Then there is severe pain and the gallbladder gets swollen. This swelling of the gallbladder is called cholecystitis. And cholecystitis, if ignored, can be a life-threatening problem. The gallbladder will continue to have swelling, and there will be formation of a little amount of pus inside the gallbladder. There will be what we call gallbladder ischemia, means that the because of the swelling, the gallbladder does not receive the adequate blood supply, and the gallbladder wall may have a small hole in it or perforation in it, and infected bile and pus may drip out from the gallbladder. Eventually, this infection goes on spreading throughout the body, and patient lands up in what we call septicemia or septicemic shock. which means that the infection is not now remained in the area of the gallbladder but has spread to the blood as well. So this can be a life threatening condition, and as such, patients who are elderly, patients who are diabetic, patients who have some reason of immunosuppression like steroids or other immunosuppressants are typically prone to develop this cholecystitis. So, what are the warning signs of cholecystitis? If you already know that you have gallstones, then a sharp, severe pain on the right side of abdomen that may be accompanied by fever or vomiting is a sign that you are developing cholecystitis. It is a sign that the body is giving you that everything is not all right, that gallstone is now causing more problems than usual. If you don't know that you have gallstones and you start developing this sharp pain, then you must immediately rush to the hospital where a specialist, either a gastroenterologist or a gastrointestinal surgeon, will take a look at you and do the necessary investigations to see whether you have cholecystitis or is it something that is even more sinister that I will come to presently. So I said that a stone may get stuck at the neck of the gallbladder. If the stone is small enough, then it will not get stuck at the neck but will traverse the cystic duct or the duct of the gallbladder and enter the bile duct, which comes straight down from the liver. Now, when this stone gets stuck in the bile duct, it will obstruct the passage of bile from the liver. That will cause jaundice. And this bile duct will now have infected bile. Like the gallbladder develop pus, similarly, the entire bile duct and liver will develop pus. So this is called as cholangitis, and it is even more life-threatening than cholecystitis. But that is certainly not the worst part, because the worst part is when this small stone does not get stuck in the bile duct but comes down and gets stuck at the opening of the bile duct into the small intestine, which is called the ampulla. The problem is ampulla. So if a stone is stuck there, it will not only cause obstruction of bile, but it will also cause obstruction of the pancreatic juices, leading to pancreatitis. And pancreatitis is perhaps the most dangerous and most life threatening complication of all of these problems that happen because of gallstones. A severe pancreatitis patient can have a death risk of around 30%. So, a gallstone that is stuck at any point will definitely cause a life threatening condition from cholecystitis to cholangitis to pancreatitis in the increasing order of their dangerousness. Now, these are the problems with small stones. What happens when the stones are large? When there is a large stone, it presents with a different set of problems. Pain, of course, yes, that is the hallmark of a gallstone, but a large stone can erode into the bile duct and cause jaundice without having to go through the cystic duct. That is called Mirizi syndrome. Okay. Secondly, a large stone, especially a stone that is bigger than 1 centimeter in size, can keep irritating the lining of gallbladder and eventually lead to formation of a gallbladder cancer. So, a gallstone, whether large or small, is never good news, is never normal, and should never be ignored. So, do all gallstones deserve surgery? The answer is not so simple, because there are a lot of issues to be considered. As per worldwide guidelines, if a patient has what we call incidentally diagnosed gallstones or asymptomatic gallstones, which means that the gallbladder has one or more stones, but they are not presenting any symptoms yet. So the guidelines say that asymptomatic gallstones do not need surgery. At the same time, it must be borne in mind that the very presence of gallstones means that it is not a normal gallbladder, it is a diseased gallbladder. So, at some point in your life, you are going to have some problem with the gallbladder. If 100 patients have gallstones, then every year, three of them will develop symptoms due to gallbladder. If you are lucky, you may be among the 97. If you are not lucky, you may be among those three that develop symptoms every year. So it is a matter of sitting on a time bomb that you have developed gallstones and are choosing not to do anything about it. But like I said, not all gallbladder stones must be operated if they are asymptomatic. There are patients in whom surgery is necessary if you have symptoms. If you have symptoms, definitely surgery is going to go ahead. But if you have asymptoms that are detected if you are a diabetic person, if you are taking steroids for any reason, if you are on immunosuppression for any reason, be it some form of cancer, be it some form of transplant, if you are living in an area that is not approachable or that does not have very good medical facilities readily available, if you are going on a long tour, if you are if you are in general not in a very good physical health but are fit enough to tolerate surgery, these are the age groups where we tell the patients that it is safer for you to undergo surgery at this point rather than wait for a complication to occur and then require a surgery in an emergency setting. Emergency surgeries for gallbladder have a higher risk of complications, have a longer hospital stay, have a higher risk of needing open surgery instead of laparoscopic or keyhole surgery, and have a higher incidence of what we call injury to the bile duct. So, given a choice, it is safer and better to have an elective laparoscopic surgery than to wait for a complication to occur and land up in an emergency kind of a situation. Now, a laparoscopic gallbladder surgery or laparoscopic cholecystectomy, as it is called, is definitely one of the commonest surgeries performed worldwide. With the advent of laparoscopy, now we have perfected the technique so much that the incidence of needing open surgery for gallbladder stones in a non emergency or an elective setting is now less than 0.04%, meaning that 4 in 10,000 surgeries. So the rate rises to 0.3% or 3 in 1,000 if the surgery is in an emergency setting. So, laparoscopic training, laparoscopic setup, the quality of instruments, the quality of cameras has now improved so much that we rarely require an open surgery. A straightforward laparoscopic surgery can be done in around 2 to 2.5 hours, including the anesthesia time, and the patient generally goes home without any surgery. So, if you have, if you know that you have gallstones, and if you wish to deal with that problem, it is safer to do so in an elective setting without waiting for a time when you require an emergency surgery. Now, what if you do end up in an emergency kind of a situation where you have severe pain, you have fever? So, the first thing to do is to go to a multi speciality or preferably a super specialty tertiary care hospital like Fortis Hiranandani, where we have right from the emergency doctor to a radiologist on call to advanced imaging like CT scans and MRI to qualified gastrointestinal and hepatobiliary surgeons available round the clock, so that in such setups the risk of undergoing an emergency surgery is minimized. The problems occurring with emergency surgery are minimized. It is tempting and probably beneficial for cost to rush to your nearest nursing home, but uh, it is important for a patient to understand that a complicated gallbladder surgery and a simple gallbladder surgery are poles apart when it comes to difficulty of surgery. So you must choose your hospital and your doctor carefully, especially when you are planning an emergency kind of a surgery for gallbladder. It is not recommended to save costs at the cost of your life. Now, coming to an important point of gallbladder cancer. Like I said, gallstones that are neglected and ignored for a long period of time may develop cancer in the gallbladder. The signs will include vague abdominal pain, weight loss, loss of appetite. Sometimes a small lump may be palpable or may be felt on the right side of the abdomen. And in advanced stages, the patient may also have jaundice. So, if you feel that you have any of these symptoms, again, it is imperative that you rush to a tertiary care super specialty center where gastrointestinal cancer surgeons are available for complete evaluation, and available, so that if you have detected a cancer, then it can be treated effectively and your life can be prolonged. We see so many patients who come to us where they are operated at a peripheral center where a mass in the gallbladder is ignored or is not caught on time, and then they come to us with the gallbladder histopathology report that says that this is cancer. There is something called a missed gallbladder cancer and there is something called an incidental gallbladder cancer. Like incidental gallstones, incidental gallbladder cancer is also without any symptoms, and the patient undergoes sonography or whatever investigation prior to surgery that does not pick up a gallbladder cancer, and only the final histopathology of the gallbladder specimen shows that there is a small focus of cancer. Such incidental gallbladder cancers have a generally good prognosis, and rarely they require repeat surgery in the form of a completion radical cholecystectomy, that is removal of a small part of liver that is around the gallbladder. The other entity is missed gallbladder cancer, where the patient has undergone gallbladder surgery and investigations before the surgery indicated that there is a suspicious mass in the gallbladder, but that suspicion has been ignored and the patient has undergone a gallbladder surgery and has now come with a biopsy report showing cancer, and probably the cancer is still there somewhere inside. So such presentation has a poorer outcome, and these patients generally require chemotherapy. They may not be fit candidates for surgery, and in general, their lifespan may be limited. So, to talk of gallbladder cancer, it is important to note that what stage the patient presents in determines the lifespan of the patient. Once the cancer has spread from the gallbladder, there is very little that a surgeon can do, and from then on, the patient is unfortunately doomed for life. surviving for a long period of time. A patient who presents early with a diagnosed gallbladder cancer can undergo a safe, open, or even laparoscopic surgery to remove the diseased cancerous gallbladder and a small tissue of liver around it. And a good cancer surgery for a gallbladder, a good radical cholecystectomy ensures that the survival of patients is in years, weeks. So again, it is important that if you have any suspicion that you are developing any risky symptoms such as a lump that is felt on the right side of abdomen or any loss of appetite, loss of weight, then it is important that you must go to a tertiary care super specialty center and show a gastrointestinal and hepatobiliary surgeon. Now, with advances, we have now come to a place where cancer surgeries and even gallbladder surgeries can be done using a robot. But a robotic surgery, the availability is as yet limited, even though it is expanding and the availability of robots is increasing. The costs associated with robots are decreasing. So, in the future, like laparoscopy took around 2 decades to achieve universal acceptance, maybe 2 decades down the line, we will see a universal acceptance of robotic surgery for gallbladder as well. Now, that completes my informative talk. I hope I have covered most, if not all, of the doubts that most of our patients have regarding gallbladder surgery. If there are any questions at this time, I would request the people to please go ahead with their questions. हाँ प्रसन्न काय फ्रीज झालाय का? Okay, that concludes my talk. Thank you very much, Fortis Hospital Vashi and Fortis Hospital Mulund, to organize this wonderful Facebook Live event for gallbladder surgery. Any and all questions are welcome at this point.